Hey, it's Dr. V, your favorite Psych NP. So today, working in an outpatient mental health clinic as a psychiatric nurse practitioner, I had a total of 14 patients scheduled. 2 patients no-showed, and I had 2 psych evals and 0 hospital discharges, which is always good. My first patient for today was a 19-year-old female transitioning to male, not on hormone therapy, history of gender identity disorder, history of moderate depressive disorder, recurrent, and PTSD. That patient is on Risperdal 1 milligram, sertraline 100 milligrams, Prazosin 1 milligram, and Benadryl 50 milligrams at night. Today, they reported they were struggling with memory loss, and this is something that I highlighted to them. This was the third time that I was seeing them, telling them that it could potentially be the Benadryl. So what I did for them was stop the Benadryl, and I increased the Risperdal to 2 milligrams. Otherwise, they're stable, and I did also recommend psychotherapy. They haven't done it in about 3 years, so it's a good time to get in with a new therapist. Next patient was a 70-year-old female with a history of schizoaffective disorder, bipolar type. She's on Risperdal, lithium, and cogentin. She started developing side effects with Risperdal. She was taking 3 milligrams. I lowered it to 2 milligrams, and I started cogentin. With cogentin or benzotropine, she developed some joint pain, so she stopped taking that, but reducing the Risperdal assisted with those side effects that she was having. My next step will be to lower the lithium. I told her it's been approximately 15 years since you had a full-blown manic psychotic episode, so it's time to start lowering those medications. She was very happy, and she also lost weight with the reduction in Risperdal of approximately 10 pounds in 3 months, which is excellent. So she was really happy and asymptomatic, so getting her off of the cogentin and lowering the Risperdal, overall doing well. Next patient, 37-year-old male, history of bipolar disorder, moderate intellectual disability, and ADHD. He is taking Abilify 15 milligrams, Adderall 25 milligrams, extended release, and Buspar 15 milligrams twice a day. He was doing excellent. Last time I saw him, I had increased the Abilify for irritability and mood from 10 to 15, and he's remarkably stable. Right now, we're just working on lowering his weight, is the only thing that he's doing, lifestyle interventions. Overall, very stable. Next patient I had, 23-year-old male, history of autism spectrum disorder, level 2, ADHD. He's taking Buspar 15 milligrams twice a day, clonidine 0.1 milligrams at night, and mirtazapine 15 milligrams at night. He also takes Concerta at 36 milligrams, very stable, no changes with him, sleeping well, programming well. He goes to a day program, no issues at the program, no issues with weight. So we're going to continue the same treatment for him. Next patient was a 17-year-old patient that I saw for a psych eval. Main complaint was anxiety, panic, was at a large school, approximately 2,400 students, and it was overwhelming, too much to be with so many people. So he transitioned to online school. However, he's still having mild anxiety, still has anxiety when he goes out to places. History of PTSD for him. I only diagnosed him today with generalized anxiety disorder. It was the first time meeting him, and I started sertraline, and I started it at 25 for 14 days, and then increasing to 50 milligrams at the 15 days if necessary. Labs, EKG, you always want to rule out any cardiac abnormalities with any anxiety issues, so I did that. And also looking at his labs to see if there's anything abnormal. Thyroid, vitamin D, iron, all those can mimic anxiety as well. Next patient was a no-show. They no-showed me, I think, because they requested to see a different provider, which was going to be me, and reducing their Ambien and Xanax. I suspect they're not ready to reduce that yet, so they no-showed. Next patient was a follow-up on a psych eval, 28-year-old female with history of schizoaffective disorder and PTSD. I had started her on Risperdal 2 milligrams, Zoloft 50 milligrams, and propranolol 10 milligrams twice a day. Today she followed up, said that the Risperdal caused some tightness and shortness of breath at night, so she stopped it. Still having mild auditory hallucinations, so I switched that to Abilify, continued the Zoloft and propranolol. She is finding efficacy with sertraline, less anxious, less worried, better sleep, and with the propranolol, she's taking that for moderate anxiety, and it has been beneficial. So we're hoping that the switch from Risperdal to Abilify will cover the auditory hallucinations and paranoia. Next patient was a yearly psych eval, and that was a 24-year-old patient with history of autism disorder level 2 and ADHD combined type, and he's only on Concerta at 36 milligrams. He's been on that since he was, I think, 16 years old, and he's just been stable. So we just kind of increase or lower the Concerta at this point. We've been keeping it the same for the last year. No changes with it. Next patient was a 23-year-old female, history of anxiety disorder and PTSD. She's only taking Zoloft 100 milligrams. Reports that it's working very well. She's in school, and she is expected to graduate in the next year and continue to progress with her life. She's had episodes where she stopped taking the sertraline, and what happens is that if you do stop it at 100 milligrams, you need to restart it at 50 milligrams for 2 weeks and then bring it back up to 100 so you don't develop nausea. And my last patient today, a 71-year-old female with a history of panic disorder and moderate depression. She is taking Effexor 75 milligrams, Doxepin 25 milligrams for sleep, and she also takes as needed 0.5 Klonopin that she takes approximately twice a week as needed. I didn't make any changes with her. She's remarkably stable, and overall it was a good day in practice today. As always, thank you for watching, thank you for listening. One of the best careers that you can have, helping your community, helping people do better. Sometimes they need medications, sometimes they don't. And I've always said, and will continue to say this before, when you pair medications with therapy, it's like a double whammy, and therapy has been shown to be as effective for certain conditions like anxiety and depression with just therapy. Medications are going to boost the effects and have a rapid remission, but therapy is always my #1 course of treatment. As always, thank you for watching. Thank you for listening. Any questions, drop them in the box, and I'll see you on the next one.